So I didn't manage to get slides, but I mean, you are overwhelmed by slides and information. So, and I think during this day, you pretty much understood why we need testing. So on one hand, we had this, I think, interesting session at the beginning of the week, of today, about the industry forum, where also Lapo presented a little bit, and also Claudio put it again here, the testing continuum and why this is aligned with the product development. And if you read carefully the regulation, there is chapter 3. It's about 40 pages out of the 300 and something, which is about how to regulate the market in Europe for the electronic healthcare record systems. And it's talking about everything. Everything is pretty much already organized and planned inside. And there is a clear definition there that there will be formal testing and self-conformity assessment and all these things. So, I mean, if we want to talk about why testing on the concept of the regulation, then you just have to go to Article 40 or something like that. I think it's Article 40, and then you will understand why we have to start planning for it. So in the series of meetings, because this is not something that was started yesterday, there is a continuation of projects since EPSOS that we managed to get up to this point with commission recommendations, with projects that created a lot of things. And the series of tools that Alain will describe afterwards is based on this continuous, let's say, evolution of why do we need testing. So in our context, I think one part is the regulatory part. So we need to prepare all together as an ecosystem to try to ensure that this regulation will create a stable European market. So with the IHE Europe sense, this is pretty important to us because in practice and in theory, it will help us collaborate even more with the vendors, but also with the users, because in the joint action and in all the similar projects, we are talking a lot about the exchange format, which, well, Marcello left again. So we are talking a lot about the exchange format content, so how to structure the documents and everything, but we are not talking so much about the use cases that Andreas said. So why do we need that? So in some documents, it's pretty clear. Why do we need a medical image and why do we need a lab report? And maybe this is our strong point from the IHE ecosystem, because we have already thought about those use cases. They're already out there. And the idea is to see from the existing IHE profiles that are somehow solving part of the equation, maybe not in the way that the regulation will propose, but in this, let's say, continuation of evolution, it's potentially our job to secure that the specification that will evolve will be testable as well. And I think this is the important thing, and this is what we should work all together. And you heard this morning that the European Commission and the Joint Action are open to listen to the stakeholders, all the stakeholders. So I think from our perspective, we have two major roles. One role is obviously evolve the testing tools and ensure that through our testing events, plug-a-thons, connect-a-thons, and all the other things that we are doing, we are supporting this process and helping the vendors in their alignment process. I think the other work that we need to do, and let's see what we can do in Vienna, is try to evolve the user community, so the stakeholders, the healthcare providers, and some even the patients now, to try to request the right use cases so that the implementation, the transactions, the way that we're going to exchange, the exchange format, and maybe other things, because remember, the conformity is not going to be only about the content of the exchange format. It will be about some security rules, some logging rules. We have ATNA, or it's the evolution. So again, we don't have to start from scratch. And identity management. So those use cases can work both at the context of the cross-border, which is already pretty set from EPSOS times. So a lot of the work should reuse and emphasize on expanding this approach, but also at the national level or regional level. In some countries, healthcare is at the regional level. So it's going to be a quite complex ride. And I think the European Commission understood, all the DGs that are involved at least, that they need to open the discussion and start testing with whatever we have, even now, immediately, so that we get this collaboration ongoing, so that when the formal implementation acts will be out, which will be 2 years after the formal, let's say, start of the regulation. And to my understanding, this has been set as March 18, 2025. So you should expect that the final legal text will be around March 2027. So, and then the process will take another route. So until then, we should use our efforts to try to be as solid as possible, both on the tooling, but on the use cases. So, and I think that pretty much answers the question about IHE testing, right? So Andreas was very vocal about the IHE methodology. So we know what we are doing. It has been proven that it works. It has been adopted by so many vendors. And the idea here, because we are talking about the European marketplace, behind all this is the creation of European marketplace, we need to address all the sizes of the vendors, so, and also the new innovative ones. So the joint actions will try to conceive some use cases for telemedicine even, maybe in the cross-border context for the moment, but everything is evolving and has an evolution. So it's also a good thing for us to try to go a little bit out of the box and start thinking what type of new use cases we would like to test. So telemonitoring, disease management, population health, all these new use cases might come up. So we know that we have technical committees in IHE that deal with those things, but unfortunately not with the European framework. So I think, especially for IHE Europe, this is a huge opportunity to put the grounds properly, and not only for the vendors, but for the users as well, I would say. It's also of radical importance that it goes both ways. So I don't want to take more time, because I think it's better to leave room for the description of the testing tools. Okay, 10 minutes. It was pretty, not too bad, right?
Perfect.
Okay, so thank you very much.
Thank you.